Dr. Manjiri and Dr. Amey, we can start in next 2 minutes. I think the attendees are still joining, so we'll just wait for next 2 minutes and then we'll go live.
Sure. Should I mute myself when ma'am is
Yeah,
on?
you can. You can.
I can? Yeah.
Ma'am, I think we can go live. So, good evening, all of our attendees and the panelists for the day. So, it's a great pleasure to have you all in this evening, and we are going to discuss with the continuation of our series, Attention to Emotion. So, I once again welcome you all. And Attention to Emotion is an initiative by I'm the Best Mom. So whenever we give any statement anywhere, so it carries some amount of emotions, and emotion behind the words are more important. The need has further raised in this difficult time of pandemic and should be treated with a new normal. So today, our topic of discussion is with child's anxiety and anger. And we are lucky to have you, ma'am, today. Let me introduce all of you with you, Dr. Manjiri Deshpande. When ma'am is here, it is definitely for us, it is an honor. You have been participating and supporting I'm the Best Mom initiative, and we'll continue our initiative and share more in details with related to child well-being, be it with nutrition, be it with the other aspect where the child growth, development, anxiety, anger, emotion. So we are here to address every topic related to children. So ma'am comes with a experience with child and adolescent psychiatry of 7 years. She has completed her DNB psychiatry after MBBS and also done the fellowship in child and adolescent psychiatry thereafter. Dr. Manjiri is a former senior resident at Topiwala National Medical College and Nair Charitable Hospital in Mumbai. Along with a toddler, she heads a chain of center child guidance clinics under the name ICGS, Indus Child Guidance Clinic. They have a center across India and also have a multidisciplinary team a very energetic team to support the children, adolescents, and young adults. Dr. Manjiri interest areas are child development disorder, adolescent and young adults counseling, parental guidance, anxiety, and depression and counseling. So today we are going to learn a lot of things from you, ma'am. And I would be requesting all the attendees to put up their question in the QA section as well, so that we can take up those questions after the session. So ma'am has been conducting different workshops in the schools for the doctors and international events and been into the domain deeply. So Dr. Manjiri has been speaking on various platforms, be it digital as well as socially. She is well connected. So ma'am, it's a great pleasure to have you here. And with this, it's also a pleasure to introduce you all with Dr. Amey. So Dr. Amey comes with a very enthusiast, particularly when it comes to children with neurodevelopmental disorder, and that is one of his favorite area where he is giving his lot of effort. Dr. Amey Pusalkar is a consultant psychiatrist at Lake Hospital, KMC, Infinity Medisearch Hospital, and a consultant at Ma Vaishnavi Hospital in Thane, Mumbai, with a 2.5 years of experience. Dr. Amey comes with a psychiatry degree from Department of Psychiatry, Nair Hospital, Mumbai, which is one of the only two centers in Maharashtra where autism and learning disability certification is done. Dr. Amey is a former senior resident at Topiwala National Medical College and Nair Charitable Hospital in Mumbai, and has been a medical officer of drug treatment clinic at King Edward Memorial Hospital in Mumbai as well. So he's trained in de-addiction from National Drug Dependence Treatment Center, AIMS, Delhi, and also a rational emotive behavioral therapist. So here like having you both is a great honor. So today we will be discussing in and around the current challenges which the kids are going through, which has further compounded with COVID. And addressing this two topic is definitely, it's every house has this kind of subject to be for a discussion. So ma'am, over to you. And we would be seeking the complete involvement from the attendees as well. So let us hear from you, ma'am.
Thank you to your wonderful team and thank you for taking up this initiative. I Am Best Mom is indeed a very nice initiative. You all have done very nice stuff on Mother's Day also. Giving appreciation to mothers is something that not everybody does, and I think you all did a great job at that. And again, taking up these kind of topics about different emotions in children, especially in COVID times, I think is extremely important. So thank you for doing this and welcome to all the participants. I hope all of you can, learn. We can all share and learn together in this next 1 hour that we are going to be together. So I'm going to be talking about anxiety in kids. Basically, is my clear? My PPT, is it visible?
This is visible. You may full screen.
Yes. Okay, so I'm talking about anxiety in kids and about anxiety disorders, not only in COVID, but in general, which have, of course, increased during these COVID times. So I would like to take up some questions. So the first question is to all the parents. I think you all can answer these. What are normal emotions in kids? So which of these are normal emotion in kids? Happiness, sadness, anger, or all of the above? So I think you'll have the poll system. So I think the attendees can vote and just I'll give you all about 30 seconds and then I can explain the answer. So Vaishali, will I be able to see what they have voted for?
Yes, ma'am, you can.
Okay. Yes.
So the question is that what are the normal emotions in kids? Happiness, sadness, anger, or all the above? So we have received.
I don't know if they voted. I don't.
Yes.
Okay, great. So I think parents, most of them are well aware that all these are normal emotions. Of course, some parents have voted for only happiness or only anger. But yes, the truth is happiness, sadness, anger, frustration, despair, loneliness, these are all emotions that are normal as much in adults and so also in children. So it's not that anger itself is a disorder, it's just that the persistence of some of these can be a problem. So children as much as adults show all kinds of emotion, that too from a very, very young age. I have a toddler at home and this is when I'm actually experiencing child psychiatry in practice. And yes, I can see all these in even my, he is now 18 months, but even from the time he was 6 months, I could see him expressing all these emotions. So yes, all these emotions are normal in kids. So moving on. Okay, so this is just I just made this wheel. I mean, these are the normal emotions in children. So sometimes to help your children express emotions, sometimes a visual picture like this helps when your children can identify what is it like to feel angry, what is it like to feel sad, when can they feel embarrassed, when can they feel bored. So these are all normal emotions in children. So again, these are not questions, but just want you all to read these sentences and think in your own minds whether this is true or false. So this is basically to bust some of the common myths that parents or that normal people hold about children and about psychiatric disorders. So children do not feel anxious or sad. Children cannot have depression or anxiety disorder. Any psychiatric illness is a sign of weakness. The child can help himself or herself. Psychiatrists only give medicines, and these medicines cause a lot of side effects. So why I've put these specifically is these are some of the most really is, what do you mean by a child psychiatrist? Do children actually have psychiatric disorders? And the truth is that more than 50% of psychiatric disorders in adults actually start before the age of 14. So before 14 itself, many children have started showing signs of psychiatric illnesses, which if not treated well in time, of course, can go on and progress more and more. So yes, children do feel anxious, sad. Children can have depression or anxiety disorder. It is in no way a sign of weakness. It is just like any medical disorder. These are disorders of the body, of the mind. The child cannot help himself. We do not only give medicines. That's the biggest myth that a lot of doctors also hold in their minds against us. We don't only give medicines, we also do therapy, we also counseling ourselves. And yes, some of our medicines may have side effects, but that's to do with any medicine in general. These medicines generally are given after a lot of thought in our mind, and yes, only when the benefits outweigh the risk do we resort to medication if it is absolutely needed. So these are all false things. So if any of you are holding these things in your mind, please know that these are myths and there is nothing true in any of these sentences. So what, coming to my main topic, anxiety. What is anxiety? Anxiety is a normal part of childhood. Every child goes through these phases. All of us even now are going through phases of anxiety, especially in COVID times. But yes, these are in phases. What is a phase? A phase is temporary and usually it is harmless. What is the difference between normal anxiety and an anxiety disorder? So children who suffer from an anxiety disorder consistently experience fear, nervousness and shyness, and they, because of this constant fear and shyness, they actually avoid places and activities. And the difference is, if your child has just anxiety, you can talk him through it, you can reassure your child. But if a child is not getting reassured easily or needs constant reassurance, it can be a sign of an anxiety disorder. So we should know in our own minds what is normal and what is progressing towards an illness, what is progressing towards an anxiety disorder. So all children, of course, have fears and phobias. So fears and phobias is a normal part of growing up. It's a developmental thing. All of us, when we were children, also had, when we were small, we had our own share of fears and phobias. So there are, childhood fears are very common. So they range from very non-specific to specific things. Like there is a particular age in which children are very scared of animals. A 2-year-old is very scared of strangers, and sometimes children are more scared of something that is very abstract, so either about death or about monsters, about ghosts, about bad people, etc. But these are normal childhood fears. There is nothing abnormal in this. Some fears seem to be age or stage specific, occurring frequently at certain ages. I will tell you this in the next slide. So what are these? So when your child is like a baby, when 6 to 9 months, they usually, when they have started recognizing the mother, they show a fear of strangers. So when somebody who is not the mother or the father or an immediate caregiver picks up the baby after 6 months of age, the child shows some kind of fear. It's not that the child was obviously able to speak, but in their body language, the child starts crying. The child is not easily comforted by anybody except their primary caregiver. When the child is about 1 or 2 years of age, that's usually when we start taking the child out, and suppose you try to leave your child with somebody else, the child has a lot of fear of separation. So that is the age when they are extremely clingy to the mother, especially between 1 or 2 years. Again, this is very normal. Again, some children do not like to sleep alone. They're very scared of dark. But around 4 years of age, this is considered normal. So if your child is 4 or less than 4 and you're expecting him to, kind of sleep alone or not be scared of the dark, then it's an unreal expectation, because yes, this is a normal childhood fear. Most of these fears resolve with time. So these children outgrow this. By the time your child is 4 or 3, your child will no longer have the fear of separation, and he or she will be comfortable to move on without you also. However, some of these fears kind of persist, and that is when we have to see if it is becoming a disorder. Why is anxiety increased in today's times? So why, a lot of people tell me, a lot of parents especially make the statement that, why is my child so scared nowadays? Why is my child having a psychiatric illness? I had witnessed so many problems in my childhood or when I was an adolescent, and I never needed the help of a psychiatrist. I never needed to go and speak to a counselor. So this child is probably making it up, or he wants attention. This is a very common thing that parents tell me. But yes, the times that were in previous generation is very different from what today's generation children are experiencing. So the truth is, in today's generation, the children are actually experiencing far more stress and anxiety compared to any previous generation. Families are going through a lot of stressors. There is a lot of environmental dangers. This is not specifically COVID, but a lot of things that are going on in the environment, much more than what probably when the parents were growing up. Media exposure. Today, every kid, I think from the time the child is born itself, is exposed to a screen, right? So this is something also that has heightened the fear and anxiety in children. So the digital world, living up to social media expectations, peer relationships, school problems like bullying, etc., are definitely were there 20 years ago, but their intensity is definitely much more in today's time. And of course, the whole corona and the whole lockdown. So today's kids have a lot on their plates these days, and that is one of the reasons why anxiety is much more common in today's times. So I told you sometime back that anxiety is normal. So when does it become a problem? When do you have to start worrying about it, or when do you have to think that it may be a disorder? So if the constant worrying lasts very long and when it actually interferes with the child's life, that is, he is not able to participate in activities, he is unable to attend school properly, or he is unable to enjoy his relationships. So just keep these three in your mind and understand that if anything is causing a problem in one of these or all of these, participation in activities, attending school, and enjoying relationships, that is when the anxiety could be problematic, and that is when we need to do something about it. So again, a poll question for you all. Is there, I think I explained the answer, but just, is there a difference between anxiety and fear? So yes or no? I mean, we use these two terms quite interlinked, but yes, is there a difference between anxiety and fear? So you all can either vote for yes or no. So I'll just wait for some time till the poll answers come. So again, the question is there a difference between anxiety and fear? You can either vote for yes or no.
We'll wait another 10 seconds.
Yeah, no problem. Very good. So yes, there is a difference between anxiety and fear. I'm so glad that 93% people voted for it. No problem if you didn't. Let's just try and understand what is the difference between anxiety and fear. So the answer is yes, there is a difference between anxiety and fear. So what is that difference? So it's something like this. Fear is when, there is a stress response from an immediate danger. So the whale knows that, the fish knows that the bigger fish or the whale is after him. And you know that there is something to, in your vicinity that you're getting scared of, that is a fear. But when there is nothing around and still there is a constant restlessness or there is a constant worry, what if the bad fish comes out today? Without any pertinent danger in your surrounding, if there is still a stress response that is being activated from only your thoughts, that is anxiety. So a fear is basically of something that is known, and anxiety is when there is a fear but not of something known. When you don't know but you're still fearing, that is more like anxiety. I hope the difference is clear. From immediate danger, when your body gives a stress response, that's called fear, and that's generally a protective reflex, right? But when you don't have an immediate danger in your surrounding, but still your body goes into this kind of fight or flight response, that is when you are getting into the anxiety mode or the panic mode, basically. I think I have another last question. Question number 3, how does anxiety present in kids? This is very interesting as to a lot of parents ask, like, how do I know that my child is anxious? How will the child present? How will the child show the symptoms of anxiety? So will the child cry constantly? Will the child be irritable? Will the child avoid school, or all of the above? So how does anxiety present in kids? Does the child cry constantly because he is anxious? Is the child irritable? Is the child actually avoiding school, or all of the above? So which of these symptoms are symptoms of anxiety in kids? Child crying constantly, child being irritable, child avoiding school, or all of the above? Great. So very nice to know that the audience is very, very well read. I think the answer is 74% of people have voted for all of the above. Yes, the child with anxiety need not specifically be crying or be irritable. It can be any. There are many, many signs and ways in which a child can present in anxiety. And yeah. So how does anxiety present in kids? That means, how do you know that your child is probably anxious? I don't only mean an anxiety disorder, but how do you know that your child is experiencing some kind of anxiety? The child finds it difficult to concentrate. So your child who is doing extremely well in academics or decently well in academics suddenly complains of not able to concentrate in class, is not able to sleep properly, or wakes up in the night with bad dreams. Your child who was eating decently well is not eating properly anymore. Your calm, cool child is suddenly getting very angry or irritable or is showing a lot of outbursts, and you start thinking that your child is getting very defiant or your child is becoming, like in typical parent language, a bad boy, etc. It can also be a sign of anxiety. Your child is actually worrying and your child is telling you that they're having negative thoughts, but not every child may be able to express. Your child is feeling tense and fidgety, or you see him going to the washroom very often. The child is crying. The child is being clingy in terms of not allowing the parent to leave him, being wanting to be with the mother or the father all the time. Or a very common presentation in children, which many people don't know of, is complaining often of stomach ache, headache, or feeling very unwell. So a lot of children who present in anxiety in this form, so they've been to multiple pediatricians, a lot of tests have been done, and they don't understand what the reason for the stomach ache or what is the reason for the headache. And after all these investigations, does then somebody realize that probably it could be just anxiety? Yes, anxiety can also present in somatic forms. That means the body can start showing signs in the form of stomach ache and feeling unwell in general. So yes, anxiety can present in a lot of ways. Like again, this is just a pictorial presentation of what I described. So last bit, there are some anxiety disorders. So I was till now I was talking about anxiety, which is normal in children. But again, like the slide when I said, when the child is not able to participate in activities, when the child is avoiding or having problems in their relationships because of that, it could be an anxiety disorder. There are some types of anxiety disorders that we diagnose in children. The most common ones are separation anxiety disorder. Again, separation anxiety, like I told you, between 1 to 2 is very normal. But when it starts becoming very persistent, or suddenly an 8-year-old is being clingy and not going to school, etc., it could be separation anxiety disorder. Phobia is when they have excessive fear of something known, like fear of insects, fear of heights, etc. A generalized anxiety disorder is when, without any reason, the child is overly anxious all the time. Social anxiety disorder is something that is very common in teenagers. That means on their phone they can be having multiple, they can be extremely active on social media, have hundreds of friends on Facebook, Instagram, etc. But when it comes to real interactions, when it comes to them talking to these friends or presenting something in public, they shy off and they are not able to maintain real relationships. This could be a sign of social anxiety disorder. Panic disorder is somebody is absolutely normal, but they have episodes of extreme anxiety and it occurs in bouts. Post traumatic stress disorder and obsessive compulsive disorder. In today's times, in corona times especially, I have seen a lot of children presenting with OCD, because we're all talking about cleanliness, we're talking about hygiene, etc. There is a fine line to doing it well enough, and there is a fine line to being obsessive about it and going towards obsessive compulsive disorder. And the last question for the audience is, will a child's anxiety go away naturally, or does he or she need treatment? So this is when it has become excess. Will it still get better with time? Will the child need medication, or will the child need therapy? So what happens when a child has an anxiety disorder basically? Does it get better as the child ages? Will the child need medication? Will the child need therapy?
Well, here the answer is, let us wait another 10 seconds.
Yes.
So the question is, will a child anxiety go away naturally, or he or she needs the treatment?
Yeah, so does the child's anxiety disorder get better with time? Does the child always need medication? Does the child always need therapy? Therapy is in the form of counseling, basically. Okay, so some parents feel that it will get better with time. Few parents feel that it will need medication, and few parents feel that the child will need therapy. More parents go for therapy. I think it's a combination of B and C. Anxiety does go away with time, but if it is an anxiety disorder specifically, it doesn't get better with time. It can at times worsen. In fact, between medication and therapy, it is a very individual decision, so it's very difficult to generalize that answer. A particular child may get better only with therapy, but if the child has some kind of biological symptoms, as we call it, the child may need a small dose of medication for a short while, and of course therapy. So we do prefer therapy in children, but yes, at times we have to use medication because it is pretty severe. So yes, medication and therapy both can be used for treatment of anxiety disorder in children. So what will not help? So parents, I know, feel very helpless that my child is going through this. I want to be, I want to help my child in my own ways. But yes, these four things will not help. Constant reassuring. So every time your child comes and tells you, I know your immediate reaction is reassure your child. But this kind of constant reassuring itself can sometimes be increasing, especially if your child has obsessive compulsive disorder. Constant reassuring is generally not advised because it only reinforces the symptoms of the child. The child only feels better when you tell him that he is going to be fine. Being impatient. So obviously when you see your child avoiding school, you tend to get a little impatient as to when will he get better. These disorders sometimes take time to treat. So yes, being impatient will not help. Permitting avoidance. Your child is extremely scared of going to school or being away from the mother, and you feel that it's causing a lot of problems in him. So you tell him it's okay not to go to school for a couple of days. This happens a lot when the child has, say, school refusal, and the child is scared to go to school. But allowing him to avoid school, allowing him to stay away from his activities will only increase the problem. And of course, being over involved. Some parents, I'm sure all of you have read this term. It's very common in, as a parenting style. Helicopter parenting means being extremely involved to the point of being over involved. So some parents, don't want their child to get shouted at from the teacher because they know the child is anxious. So even doing the homework for the child, this is a typical example of an helicopter parenting. But yes, this makes the child extremely dependent. So these four things will not help your child. What can you do to help your child? This is the last slide. Some things that at your level, what you can tell your child to do. Deep breathing. I think Dr. Amey is excellent at yoga, so I would request him to demonstrate this. But yes, deep breathing or belly breathing is definitely helpful. I think we all know that, deep breathing, what happens when we are anxious is our body is going to this flight or fight response, and there's superficial breathing happening. So we breathe very rapidly and very fast and very shallow. So kind of doing the opposite. So breathing through your belly and taking very slow, deep breaths helps. Giving them a transitional object, like, hugging a teddy bear, having a blanket that helps them. For some time, this helps. Positive self-talk statements. I am going to fight this. I am going to be okay. Helping your child to say these kind of statements 5 times a day, every day to himself helps. Calming visualization. Your child is very worried, has monsters or has all these anxiety provoking images in his mind. Having him, giving him some image which helps him, generally greenery, generally some kind of very nice environment picture, showing that to the child and helping him to imagine, that helps. Talking back to the anxiety. So children can be helped by telling them to talk back to the anxiety, so to help them to fight it. Having a journal. So if your child can write, if your child is old enough, helping him to have a worry jar, write whatever his thoughts are in a journal helps, because it helps him to get rid of these thoughts to a certain extent. And of course, yoga, muscle relaxation, and physical exercise definitely helps in these. So what are some of the things that, beside these, what we tell, we tell the child, you can distract yourself, drinking sips of water, reading a book, listening to music, 5 deep breaths, taking a break from whatever they're doing. If they're studying something and feeling extremely anxious because of it, taking a break, talking to an adult at home, counting numbers slowly, or physical exercise. These are some of the things even a very small child who is feeling anxious can do, and definitely at least temporarily feel a little better. So in the end, would just like to, Winnie the Pooh is a favorite among all children. So always telling your children this quote, that you're braver than you believe, stronger than you seem, and smarter than you think. Telling your child positive statement like this, and more importantly, believing in your child is utmost important. Showing your child, and more importantly, expressing your emotions. Telling your child it is normal to feel anxious. So in today's times, especially, I tell parents to sit and talk to their child and also express what they have been feeling during Corona or during this whole pandemic. So a parent typically sitting with the child and telling him, I know you're feeling anxious. It's normal, because even I'm feeling anxious. So that kind, when that child feels that even my father, whom I idolize so much, can feel anxious, the child feels a little better about himself and then starts opening up. So always sharing your own experiences helps your child to open up to you. And I think a parent can definitely be the first best doctor for your child. And of course, beyond that, we are there to help your children. Thank you very much. That's the end of my presentation.
Thank you, Dr. Manjiri. And
Yeah.
I believe all the slides, it's more important, like sometimes I believe certain factors, like whether it is exactly called fear or anxiety, or maybe there are many things which are not been clinically evaluated by a parent. But when it comes to addressing the challenge, which is the ultimate thing for any parent, I believe a lot of question coming in different, like we are also live on Facebook, so are also coming from there and the other handle. So we will be getting into a question and answer in a short while, and uh, let us also go through the perspective what Dr. Amey is bringing while managing the child, particularly when they are in anger. Dr. Amey.
Good evening. Hello. Namaskar, everyone. Yeah. Can we have the yes? So I would like to start with what is anger. Basically, what is anger? Everybody gets angry. Me, I also get angry. You also get angry. Everyone in this world gets angry. So why do we get angry? The reason is that our expectations or the beliefs that we hold or the opinions that we hold, our attitudes, our likes, our dislikes, if these borders are crossed, we get angry, we get into an uncomfortable zone, and then that's where irritation starts, frustration starts, and anger starts. So anger is that emotion which is expressed when something that is happening against our wish, similar with child, similar with adults also. So we are talking about childs today. So yeah, next slide. Yeah, next slide. I'll show you what are the manifestations of child's anger. So there are two types of basically in roughly we can divide it as behavioral manifestation and as an experience what a child goes through when he's angry. So temper tantrums. So all the parents, all of you parents, you must be knowing about temper tantrums. Generally, temper tantrums last till the age of 5 years or 7 years, till the child is not able to understand something like a cause and effect relationship or a logic kind of a relationship. So at that time, there is egocentration, which means that I want something now and I want it now only. So it's difficult to pacify, but there are techniques to manage that also. So that is a temper tantrum. Then there is stubbornness. Now, stubbornness is something which is you tell your child do something and then they just refuse to do it, or they don't just pay attention to it. Now, this might be a part of a child's temperament, which is like a personality. For an adult, there is temperament for a child. This might be a part of child's temperament, or it can be newly started. So we have to look out for that. We'll talk about that later. Then giving back answers. Yeah, giving back answers is the most common thing that parents tell these days. Uh, children are giving back answers. I tell them to do something and they just why don't you do it, or a lot of things have turned up from children's liking disliking during this lockdown period. So back answering has increased. Then there is non-compliance with parents instructions. So obviously if a child is angry, definitely, and if anybody is angry, then if the child is angry with a parent, the child will definitely not listen to the parent. Certainly, if you are angry with your boss or something like that, you will not listen to the boss. So then you have to listen to the boss because he's the boss. That's not a compulsion with the child. Then there is refusal to talk and eat and avoidance. So this is also a manifestation of anger in children who are a little bit older. generally around the age of 7, 8, or 9 years of age, when they start understanding logic, when they start exploring how a thing happens. There is cause and effect thing that they start understanding, and then they just get into a slightly mild kind of showing anger. It's kind of a sophisticated kind of showing anger, refusal to talk, eat, or avoidance. Again, that also depends upon temperament of the child, and it might be a newly started thing which they have started according to the age. Then argumentation on trifle matters. This is also on the rise nowadays. There is a lot of irritability in children because of movement restriction, and otherwise also when children are not in a mood for something, they will argue on trifle matters. So we'll talk about why and how it happens later on. Then bullying or beating younger children, that is also a manifestation of anger. This can happen in multiple ways. I'll just give one example. If a parent just uh, shouts on a child, and then the child will go to the younger sibling, and then he will beat the younger sibling up. This kind of displacement also happens in children's life. And then there is aggression. It can be verbal, which is something like giving abusive, using abusive language, and then there is behavioral, which is use of violence. So roughly, I would say up to point 5, the things are under control. But when it goes to 6, 7, and 8, you have to pay attention to what is happening to the child. You know, because argumentation on trifle matters and bullying and beating and aggression are something which are associated with certain specific disorders in children. Yeah, we will talk about that also later. So what happens to a child when he is angry? How does a child express in words when he's angry? So the child says that, I don't want to talk to anyone. I just want to stay alone. These are also what an adult feels. It's not very different from what a child feels, but the way of expression of child is a little bit in the gray zone where we need to put some special attention to it. There is something like body feels tense, and then there is irritating feeling in the chest. There is some burning kind of feeling in the chest. That's what they say. Then there is shaking of the body, increased heartbeat. Then feels like head will explode when there is extreme anger. And then there is, of course, if there is extreme anger, this kind of emotion which increases your heartbeat, makes you tense, makes you, go nuts, then you just want to get out of that kind of feeling. Yes. And then there is something like feeling like breaking something, and then feeling like hurting self also can be a manifestation of anger. So here too, I have arranged it in a in an ascending way. If it's like from 5, 6, 7, 8, these expressions require a certain attention, probably an attention from an expert like a mental health professional, because feeling like head will explode and just want to express things out or want to break something, this is a disruptive kind of a behavior. So this requires attention. So that's how I've arranged those manifestations. Okay, so we will now go to the next slide. And on the next slide is a question for all of you. And this question is anger an abnormal emotion? Actually, this has partly been covered by ma'am in her presentation, but let's go through it. Okay, can we?
Yeah, Dr. Amey, let us wait another 10 seconds. People are replying. So the question,
Sure. Yeah.
anger an abnormal emotion? Yes, no, depends on the severity, depends on age.
Depends on the age.
Very tricky question. It's
Yes.
something like it is already there, but we as parent or as a guardian, how we see it. This we are talking for the children perspective or anybody.
Yep. The answer is also pretty interesting. Yeah, so yes, for 19% people say yes, no 19, then depends on severity, it's 59%, depends on age, it's 7%. So yes, anger is not an abnormal reaction, it is a normal reaction. Everyone has anger, everyone has to express anger. Now imagine a person who cannot express anger and keeps it inside. What will happen? One day it's going to explode. So expression of anger is also important. It's an essential emotion in the arsenal of emotions that we have. So I explain the last two options, which are depends on severity and depending on age. Why I have put those options is because, yes, definitely severity and age have a correlation with anger, and that those form diagnostic criteria for certain disorders. You know, you don't expect a child which is 5 year old to just start abusing or breaking things, or just threatening with a knife or something like that. You don't expect a 7 year old child also to bring a big rock at home and threatening to break things like that. So that kind of severity at that kind of age is an indicator of certain psychiatric disorders which are seen in children, which I'll just tell the names of them. There can be oppositional defiant disorder, conduct disorder, and there are impulse control disorders. There are disruptive mood regulation disorders also. So whenever you find that there is the correlation between age and severity is no think about getting help. That's why I framed that question in that way. So yeah, common reasons for children's anger. Now this is a very interesting topic. So yeah, so what happens now, this I have divided in two categories roughly. This is related to parents, and then there are other reasons. So related to parents, I would give more weightage to that, because child, there is a lot of imitation when a child is growing up. There is a lot of things that child picks up from their parents and significant other figures that are in the house, uh, or primary caregivers if there are no parents. So just imagine a situation when your child has just come home and he's like, Mama, today what happened is, my teacher, she taught me maths and I was not able to do 5 plus 2 plus 3. And the mama is, or daddy, there is no gender bias in this. Yeah, they are going like, they are on a laptop or on a cell phone. Yeah, okay. Yeah. Huh. The child will pick it up. The child will, especially if it is the age group of 2 to 5 years or up to 7 years, the child will pick up that behavior, because they don't have logic at that point of time. They just think whatever is happening is normal. So not paying attention becomes something like, they take it as kind of a normal behavior, but then later on when they start understanding, anger develops. My teacher, my mother or my father is not paying attention to me. Just imagine yourself in that position when you're trying to talk to someone and that person is not paying attention to you. How would you feel? Exactly the same way severely the child feels in that context. Invalidating child's feelings, now this is also very important thing. What happens is, again, I'll just give you an example. The child comes, and then the child has fallen down playing, was playing outside, and then he has got hurt, he has gotten bruise on the knee, and the child comes crying, 7 8 year old child. And then the mother or the father just says that, it's just a bruise, man, come on, they don't have to cry for that. It happens, and it will heal. So that kind of invalidation of child's feeling, the child is hurt at that moment, is sad, he's having pain. So you have to comfort the child. There is the child requires comfort, the child requires care at that point of time. And if this emotion of his is invalidated, then ultimately it turns up into anger someday, because ultimately the child gets bored or tired of invalidating behavior of the parent. Then there is comparing with other children. That happens a lot. This is also one of the reasons for sibling rivalry. There is comparison with the younger sibling or the older sibling, or comparison with the neighbor's child. अरे उसको तो 98% marks आए, तुमको कैसे 70% marks आए? हो गया. The child gets angry. The comparison is something which no one likes. Imagine yourself being compared to some person like Sachin Tendulkar. If then someone continuously tells you Sachin was like 16 years of age, he was playing cricket for India. At 20 years of age, he had a car, he had a trophy and had so much money. If they tell you something like that at every stage of your life, you definitely are going to be uh, very irritated and angry. And then there is commanding behavior. So this is most of the parents are used to doing that, commanding and instructing behavior. Now, some children, uh, they depend upon their this slide. There are other reasons in which I have mentioned temperament. Some children who have a temperament of that kind, who listen to the parents all the time and they want their parents to instruct them all the time, will comply with that. And some children who don't have that kind of temperament, they will give back answers. Now, there is another theme also here going on. If the child has come home after a bad day at school or bad day at play, and then he starts, and then he removes his shoes or no footwear, and you start commanding, keep your shoes in the shoe rack, remove your socks and keep it for washing. This kind of commands irritate the child at that point of time, because he's not in a state of mind to, he has lost a math probably, or he has not done homework, has got scolding from the teacher, has come home, and not expecting all this thing at that point of time. And then that leads to anger. Then there are threats and warnings from parents. It's like if a parent takes a child to a market, and the child starts running here and there, picking up objects, and then the parent threatens the child that next time I will not take you if you do something like this. Or there are warnings. This is a warning actually. Then there are threats that you need spanking. And I'll spank you if you do that like this, and that in front of everybody in that market. So that thing hurts the self-image, that self-esteem of a child, and then that also leads to other problems. One of which is irritability and a kind of a attitude towards parents which is not favor parenting and in terms of listening to parents. Then there is being sarcastic. Many parents have a habit of being sarcastic. So sarcasm is something which hurts the most to a child. You know, uh, it's something that is a child is not expecting. Now, you go directly to the child. You tell them what your expectations are. You tell them how to behave, or what behavior is expected. But being sarcastic about it, passing remarks about it, so that irritates everyone, and definitely children too. And then there is name calling. It's like ये तो ऐसा ही है, ये तो lazy है, और ये तो ऐसा, मतलब इसको तो आलसीपना ही है, ये तो गुस्सैल ही है. So when you are just declaring that he is angry all the time and he is lazy all the time, so the child definitely is going to get angry. And the most important point that I have not added in this presentation, because I wanted you to listen from me, is parental role modeling. So as I said, children pick up minute things of parents' behavior. So if the parents are have angry kind of a personality, if they have a trait which they get angry very fast, or they get irritated, if I'll just give an example. If a child comes like a toddler or 2 to 3 years just started going to school, they'll ask you questions which you can't answer. Something like, why does the rain fall from the sky? Or then you don't have an answer for that kind of a question. You make up some kind of a story and you tell. Then they'll say, but then why not from our terrace? Then you'll make up another story, and then you will say, and then maybe it will pacify. If it doesn't pacify, then why not from the lake? The lake has so much water and we have taken him to the seashore, and why not from the sea? It has so much water. At this point of time, you will lose patience and then you will become irritated to your work. No. What you can do at this point of time is just, okay, that's a very interesting question. What do you think? Why the child the question? A toddler, if you explain him the process of evaporation, is definitely going to understand it most of the times. So you can just ask, what do you think about it? And just go about a casual conversation, having, you should have the child for asking such a question, kind of positive reinforcement, because curiosity is there and you have to appreciate curiosity. And then there is consistent parenting. Now, if you are getting angry, or if you don't like something, just be clear with it. As a parent, if your child does that and you don't like it, and the other day the child does that, you like it doesn't happen. Like, the child get confused. So you have to be consistent in your behavior, in the way you are going to instruct the child, in the way you are going to stop the child or sometimes scold the child, and that has to be consistent for same things. Then there is mutual understanding between parents. So sometimes what happens is, one parent is very lenient and one parent is very, of course the child is inclined towards the lenient parent. So this kind of behavior also puts the child into confusion as to what parent to follow. Child definitely will follow the lenient parent because he gets a leverage to behave in a way the way he wants. And then also, what that does is that creates a difference of opinion between the parents also. And then there are interpersonal problems between the parents related to the child, that either mom or the father, they argue about it. No, you should not behave with the child, you should not allow child to do something like this, and all kinds of things happen. Then ultimately, the one who is strict is going to displace that anger on the child, and the child is going to pick it up because of role modeling. There are many other factors. I can give many examples, but we'll have to limit to this list. Then there are other reasons, yes, and this is like difficulty in studies. Many children have something like specific learning disability, in which they are not able to understand spellings, not understand, not write properly, or not do maths properly. So, and because of that, their performance in the school is affected. And when the performance is affected, definitely they feel irritated, and they can get angry because of that when you tell them to study. Then there is bullying. If there is bullying in the school, definitely the child is going to resist it, causes irritation and anger. There is constant criticism in the school. For example, if a teacher keeps on constantly criticizing the child, maybe the child has some problem in understanding what the teacher is teaching, because of maybe learning disability, or maybe having some other kind of uh, maybe having attention problems, or maybe some other intellectual problems. But if the teacher is continuously criticizing the child, then the child will get irritated, and in the class also the child can back answer. So this is also one of the reasons. This is also one of a major reason why when I talk to children, they definitely come up with something, some teacher who they don't like, and which causes anger in them. Then there is inability to understand emotions. Now this is something like, uh, when the child is growing up, 4 year or 5 year old child, they don't have the ability to understand what is anger, or what is appropriate behavior, what are manners, and all kinds of those things. And along with that, also they are, into their own world. They have some kind of magical thinking also. They are doing their things. So inability to understand emotions is there, which is normal at that age for that child. But if this is not understood by the other person, and if child, accidentally breaks something, and then there is anger displays on the child will also reciprocate that someday. And then there is temperament. So temperament, there are, temperamentally, some children are kind of easygoing, as in they have an ability to adjust to changes. They can take bossing, or they can take the bullying, and then they can adapt to it. Some children are somewhat, they will express anger at some point of time, and some they'll adapt up to 50-60%, something like that. And then there are some children who are temperamentally difficult, who want the things the way they want. They don't like to adapt, they don't like to adjust. There is that kind of thing. And mainly, I will not blame parents for this thing, but mainly what I have seen is a child who's pampered a lot has a difficult temperament, pampered a lot in the childhood, and in the teenagers he has a difficult temperament. And of course, children with special needs, which include children with autism spectrum disorders, intellectual disability, ADHD, and other disorders that I just mentioned. Okay, so we'll just move on to the next slide, and this slide has a question for all of you. And the question is, what should be a parent's response if their child breaks an object at home? And these are the four options.
So the question, once again, let me read it out. What should be a parent's response if their child breaks an object at home? Blame the child for being irresponsible all the time? Punish the child? Depends on how costly is the object. And listen to the child before jumping to any conclusion. And I believe everybody has completed giving the answer. Or no, few are still giving. So,
That's an amazing response. Yeah. So listening to the child before jumping to conclusions. Yes, you should listen to the child before jumping to conclusions. And I would also add that, maybe the child is already might be feeling guilty about it, might be feeling sad about it, might be scared that my parent will now going to scold me. So you can just hug the child, or you can just, caress the child, and then you can ask what happened, and how did this happen. Just listen to. It's not deliberately that the child will break it. So so here are some simple parenting tips which are directly related to the previous slides. So listening or giving attention to the child, definitely yes. Everyone needs attention, whether it's a child, whether an adult, whether a geriatric person. Everyone needs attention, because everyone needs to be heard. Everyone needs to be understood, and that is act out. Child, then instead of asking a question like "What happened? Why are you so sad?" you can go like, "Yeah, you look sad today." And just stop. That point of time, the child will come out with why he is sad, because you have just picked up the emotion, and then the child will reciprocate with you, and then he'll come up with reasons why the communication will be better. Then tell the child about their feelings. A recognition of feelings is an important thing. All the things that I had mentioned in the first slide, right hand corner, the manifestations of anger as an experience. If this is happening to a child, and the child doesn't know what to call it, you just have to tell him or her that this is called anger. Okay, then after then you can tell them ways, then we can manage it. That's why it helps, with all kinds of emotions, not just anger, sadness, or happiness. Definitely it's a little bit more evident, and the child feels happy about it. So it doesn't come under that kind of introspection or speculation as anger and sadness and irritability or anxiety. Then maintain a healthy communication with your child, and this is extremely important, especially now when it is in this lockdown period, because there is movement restriction. Normally a child would go to school, share his feelings with his friends, have fun, go out, play, but the child is not able to do it now. And otherwise also have a healthy communication. Talk with the child as a friend. Just don't start questioning, or just don't give instructions, or passing remarks, pulling, all kinds of things. Just be uh, just be empathetic. If you see the child is sad, then just like I said, you look sad. Or if the child looks scared, then you can just you look pretty scared today. So that helps in coming out with things that when it's concerned with children. So then there is suggesting alternate ways of thinking which promote understanding. Okay, so this is something like uh, anger, expression of anger, if it is leading to harm to self or harm to others, or in general is damaging the school performance or friendships or relationship with parents or other people around the child, then you can teach the child alternate ways of thinking. Something like, if a friend does not pick up a phone call, or if a friend says that yesterday the friend has said that I'm going to come to play with you tomorrow and doesn't show up that day. So instead of getting angry, you can train the child to think about different possibilities. Maybe he is sick, maybe his mother or father didn't allow, maybe they had to go somewhere else. These kind of different possibilities which promote understanding, promote thinking at a greater scale. Definitely, depending upon the age of the child, you can start at like 8, 9, 10 years of age. You can start with that when they are of that age. And finally, that is allow the child to face consequences. So if you are done with everything, every tactic in the book is finished, and then uh, allow the child to face consequences. Let the child behave the way child wants. Let the child express anger, and the next time you just don't. For example, I'll just tell you that if a child wants to go to a particular place, and then the child goes to that place, and then the child starts getting mischievous, and then you scold the child, and the child becomes angry, throws a tantrum. You don't say anything at that point of time. Just be calm, get back home, and the next time when you're going at that place, tell the child that you're going at that place, and the child definitely wants to come, but this time you're not taking the child. And then ask the child, why do you think I'm doing this? So maybe the child will realize that last time I behaved in a particular way, so I'm not able to do it now. I'm not able to get what I want now. So allow the child to face consequences. This is a consequence that happens when you behave in that kind of manner. And then there are anger management techniques, definitely, which ma'am also discussed for anxiety. Take a break. Like when the child is extremely angry, they start hearts pumping and tension is building up, and everything's head is going to explode, kind of feeling. Just move away from that situation. Go to a quiet corner. Have some deep breathing exercise. Deep breathing thing. Deep breathing is abdominally. You have to breathe. It's like it has to be thought. Just you go in with your abdomen out, and you come out with your abdomen in, and slowly, if the child does that for 5 or 6 breaths, definitely the anger is going to reduce. Then express the anger in a harmless way, like doing an exercise, or riding a bike, or running. Sometimes we also recommend punching a pillow, something like that, if it's a severe anger management kind of case. Then drinking cool water, or washing face with water. This gives a sensory stimulation to the child, which distracts the child from that emotion. So All these basically techniques are for distracting the child or breaking the thought of angers that leads to extreme anger, rage, and then behavioral problems. Reverse counting, as Mang also mentioned. Then, if the child is older, think of the consequences that had happened previously when you had become angry, and if child has that kind of an understanding and age, that can be promoted. And recognize anger as emotion and let it pass away. Now this is for older children, when they do understand the consequences of what happens when we get angry, and they have passed through the phases of losing friends and having disturbed relationships with teachers, and they have now got the understanding. So now they can recognize anger as an emotion, and they know that it will pass away. Better to let it go than let it damage our relationships or other kind other kinds of things. Yeah, so we will move on to the next slide. Hmm. This is also a question. So when is anger management truly done? It's a very interesting question. When is anger management truly done? When the child is angry, when the parent is in mood to talk to the child, immediately after an anger outburst, or when having casual routine with the child. Actually, the way I spoke it, you could have read my emotions and understood the option. Yeah. So, yes, most of the people in the audience think when having routine with the child, when you're having casual routine things with the child, yes, definitely. That is the time when anger management is done, even for child or an adult. Because see, anger management, I'm not talking about anger management techniques. These are behavioral techniques which are utilized in case of emergency. When the child has an anger outburst, definitely at that moment of time, reverse counting or washing face with cold water or all those distraction techniques, they work. But when you have to reduce the anger in such a way that it does not hit that peak again, then during routine conversations or routine interactions with the child, should just bring up the topic, or in a lighter mode or in a lighter way. What happened that day? Your friend said some bad thing to you, and then you reacted something like, uh, and then you reacted in an angry way. That was such a memorable kind of an incident. So you remember what happened after that? Some kind of things you can discuss like this. So then they realize what happened, what are the consequences, and uh, how they got hurt, or they hurt someone else, or they fought with someone. And then there is always introspection going on in the mind of the child once he's 8 or 7 years old, and later on also. So yeah, we'll move on to the next slide. Yeah. So the next slide is also a question. I think, do children with special needs behave aggressively purposely? Special needs meaning I have put two categories. One is intellectual disability and one is autism. Yeah. Do we have the results? Sometimes, okay. Sometimes children with special needs behave aggressively purposely. Okay. In a way, no, this is also kind of an ambiguous question. Generally, they don't behave in an aggressive manner purposely, intellectually disabled or an autism spectrum child. But sometimes, yes, if they are provoked, and the provocation is also known to the parent, and if they are provoked in that kind of manner, uh, or if it is not known to a stranger or something like that, then they do get angry. Yes, so we'll move on to the next slide. Yeah, managing child with special needs. And in this section, I have kept intellectual disability and autism. So let's just go through briefly about autism, what it is. Autism is a disorder in which there are main three core components where there are repeated behaviors which are called stereotypical behaviors. There is inability to do get emotional reciprocity. Mostly they don't give eye contact or they don't give a smile when you smile at them. They are in their own world, and there are language difficulties, and the language doesn't develop very as the normal child has a development. Sometimes it develops and then it starts regressing, and that is autism spectrum disorder in a short because of limitation of time. So the triggers I will discuss is these children like to have a routine. It's not like they like to have a routine, but that's the way their brain has been designed. They cannot tolerate a change in routine. So if there is a change in the routine, they do get angry. And definitely when the lockdown must have started, a lot of autism children and a lot of autism uh, parents with child having autism, they must have faced this problem. Then there are sensory issues with those children, that is sensory overload. Now this is something like, imagine yourself standing in the world's busiest signal, like 10 roads are coming, and there is one signal, and this is a big crossover, and all the roads are full with cars, and then they are honking, and then your senior also shouting at you, and then at the same time there is phone ringing. How would you feel at that time? Even you will become just blank, confused, irritated, angry, because there's so much of information being just put on you. So that happens with children with autism spectrum disorders. They have even normal talking or a normal touch or sound can be like a big thing for them, a big sensory stimulation for them. So that's why we have to recognize what kind of sensory issues that the child has and deal with the child accordingly. Second thing, the third thing is stopping their repeated activity. This stereotypical activity that they do, something which is like turning on the button, turning off the button, or something like taking some ring off or putting it back. Then there is self-stimulating activity, which is flapping, clapping, dancing, making noises. If you stop it by force, definitely they are not doing it on purpose. It's the way that their brain is designed. So this, when you stop it, they get angry at you. That is a very common trigger, because this falls under the category of socially inappropriate behavior. Sometimes what happens is that these children has, because of sensory issues, what they do is they'll just go and grab something, maybe hair of some lady, or maybe a cloth of some, or maybe a kurta of some gentleman, and they're not doing it because they're angry. They just grab it, and then they refuse to leave it because they like the touch, they like the texture. Some children like all kind some textures or some touches. So all these things, when they do, the other person gets scared, and then the other person gets scared and tries in a panic mode to release yourself, and then the child gets angry. So that is something a parent or a caregiver has to understand, that at such point there's no point forcing the child to get out of it. You can give some kind of sensory stimulation to which the child responds, and then that activity will stop. So first 4 points, which are in italics, are specifically related to autism spectrum disorders, and then the next three are in general for ID, intellectual disability, which was previously called mental retardation, and for autism spectrum disorders also. So difficulty in understanding emotions and expressing emotions. Simple things like difficulty expressing hunger, difficulty expressing wanting to go to the toilet, difficulty expressing that they are hurt. In case of intellectual disability children, of course, not all children with autism spectrum disorder have pain and sensitivity, but they have difficulty in expressing even if they are hurt. So that can lead to irritability and ultimately anger. Then there is scolding or physical abuse for changing their behavior by parents. So you scold them, you physically abuse them, they'll give it back to you, but they will not change their behavior, because that's not how it happens. And then there are puberty related changes. When intellectual disability and ASD children reach at a particular age of puberty, they have those hormonal levels increasing, and because of that there are certain inappropriate behaviors that they get into, and that is severely punished by the parent or the caregiver, and then that leads to an aggressive and problematic behavior, challenging behavior for the child, and also difficulty in handling for the parent. So what interventions generally we do is, acceptance is the most important thing when it comes to autism spectrum disorders. Parents do not accept that their child has a disorder like this. They are just in a mode where if some member in the family also had late development and he's also going to develop late, but ultimately turns out to be autism spectrum disorder, and something which could have been diagnosed at the age of 3 gets diagnosed at the age of 8, and as the age increases the behavioral modification becomes difficult. Then there is psychoeducation, meaning uh, giving information and awareness to the parents about these disorders, so they can understand them, and then accordingly adapt their behavior and change their behavior, and uh, take it in a positive manner rather than blaming self or in a negative manner. Then assessment for severity is done in a specialized center that we used to do in, that happens in Nair Hospital, uh, because certificate is issued on the basis of that. Then there is occupational therapy, in which the sensory issues are dealt with. There are activities like giving them a heavy jacket to wear, or giving them some sensory stimulation which they like. So at that, there are toys, there are some things that they want, which keep them engaged in solitary activities, so that they are on their own. So these kind of things happen in occupational therapy. Then special education and training. This is also a part of in our country for autism children. In that, basically, there is behavior modification. Children are taught manners. Children are taught letters. They are shown pictures, and repeatedly this is reinforced that this thing, picture of a cow will be shown, and then they'll be tell, what is this? This is a cow. So this will happen multiple times, and then they learn the behavior also, and learn to understand objects also. Then most importantly, managing caregiver burnout, because parents of these children are really in distress, because managing a child with a disorder like autism spectrum disorder really takes away a lot of energy, and a lot of uh, gives a lot of fatigue. So there are caregiver groups also. So, and getting educated, getting information, and having to speak with someone that also manages give a burnout. And then there is pharmacotherapy if required. If the child has too much of problematic behavior, too much of something which is not being controlled by parental instruction, or an occupational therapy instructor instruction, or special educators instruction, then we will have to use certain medicines. As ma'am said, we will definitely look at the risk benefit ratio, and only if the benefits are more, we'll recommend medications for such children, only to control their behavior, so that it becomes easy for the parents to manage their behavior. Okay, I think this is the last slide, and with that I am thankfully ending this presentation. And I thank the organizers for giving me the opportunity to express myself before the audiences. And it's a wonderful thing that they are carrying out. And the Best Mom campaign is amazing. And the awareness and information that is being dispersed through this kind of campaign, it's really required since ages, but it's happening now. It's a great thing, and I wish them best of luck and lots of blessings from God. I would uh, demand for them, actually.
Thank you
Yeah.
so much, sir. And it's great hearing you. And Dr. Manjiri also, like you have also said the initial, like particularly when we are talking about be it fear or that further moves to anxiety or then manifested to anger. I believe we are somewhere in and around touching upon the emotion of the child, right? So be it even for the children who are atypical or maybe who are neuro challenged, even when we are talking about how they are getting disturbed with probably the change of a place to having like if a particular pattern is disturbed, then also they get some amount of anxiety. So I believe this is a very uh, uh, sensitive topic also, because every child is unique, and every parents are raising their kids in a way which they believe this is the best they can do. And particularly in this phase of life, expert like you, people have a lot of questions to ask, because what we are all going through we have never gone through earlier, right? There are few
Yeah,
questions which
yeah,
are coming, like
truly.
is the current phase of life, like people, the kids are not attending school, they are restricted in a four wall, and so many questions which are probably coming to you on a day to day basis. So is it something going to damage the children in long run, because it is already 6 7 months they are inside their home? So how you see or foresee life for those younger one? This is a very open
Ma'am.
question.
Yeah.
Yeah, so I am hopeful that it will not spoil anybody in the long run as such. Yes, temporarily we are all facing the side effects. I think kids are facing it the most because of their routine and their school, everything being disturbed. But I think as humans, we have been, we are gifted with a lot of resilience. That means resilience is the power that we have to overcome the challenges and overcome the adversities that life throws at us. So I'm very sure that sooner or later things will be back to normal. And yes, or if not the real normal, the new normal, and we will definitely adjust to it. Kids are definitely much more resilient than us as adults, and definitely if we give them, the positive environment that is needed, especially in today's times, they will overcome this and come out, in fact, much stronger and happier as individuals.
Right, ma'am. Absolutely. Few questions for you. I believe you have already answered a couple of in the
If
Q&A
I would,
area,
yeah.
and there are very obvious question coming in the other platform also. The question is, eating habit and the sleeping pattern is disturbed in this phase of time. Now, a disturbed sleep pattern, how is it influencing the child getting hyperactive? Or the food habit has been very irregular. They are at times overfed.
Yeah, so I would say as much as possible, try to maintain the sleep structure as you do when they attend normal school. So make sure that you and your children try to go to sleep at the same time every day as a normal working day and wake up the next morning. Yes, there can be those weekends in which we have a movie night or whatever, but let's not make this a routine of sleeping late and waking up late, because sleep is extremely important for developing children and we cannot disturb their structure too much. But in case your child is having too much of difficulty in sleeping and is not eating properly, is unable to sleep in spite of creating the right atmosphere, it may be a sign of some kind of disorder that the child is going through, or exaggerated emotions that the child is experiencing. And yes, you can consult or you can take help of a professional in order to make sure that you're not missing out on something. But more or more, it depends on how the parents create the environment at home and what kind of life do you all live. So we tell children to stay away from screens, but yes, we are all hooked onto our screens. So non-work related screen time definitely has to reduce from the parents' end in order for the children to pick that up as well.
Thank you. Thank you
I
so
would just like to add, there is one study in Italy which was performed for autism spectrum disorder children. What they did was, for sleep especially, what they did was these children respond to stimuli in their environment. So if normal child was sleeping at 10:30, what they did was they changed it from 10:30 to 9 in a way that parents would start changing their clothes, getting them into pajamas, and then creating an environment for sleep. And then they got adapted to sleeping early. So this thing can work also here also if we apply it. for autism spectrum disorder children, because if they sleep more, then it's better for them.
Right, absolutely, sir. So let me put up this question, like though it was one of the slide from you, ma'am, uh, like the self-help method, like when you are getting a bit hyper, be it adult or a child, the yoga or maybe all those pranayam thing, because Dr. Amey is also a yoga enthusiast, so let this question go to him. So how does it help?
Yeah.
Does it really help?
Yes, yoga pranayam definitely helps, but it helps in mild anxiety and mild depressive disorders, and in creating a general sense of well-being. But it has to be practiced regularly, and it has to be practiced for a certain period of time, probably weeks or months before you start realizing the benefits from yoga. But definitely, it actually slows down. It gives you an increased interval between thoughts for a normal individual. So you become a little calmer, because the yoga exercise is something like you have to hold a pose for certain period of time. So it is described in a way yoga is the union of mind and the body. So through body, you're making your mind calm. So it definitely works for milder depression and mild anxiety. But above that, when it becomes moderate or severe, you have to definitely consult a mental health professional, psychiatrist. Maybe then you will be requiring medications and therapy. So accordingly, yeah.
Thank you so much, sir. Yes, Dr. Manjiri, like I believe we could answer to all those questions, and thank you so much, Dr. Manjiri and Dr. Amey, for your valuable time as well as the lovely presentation. I believe this is not going to end here, because a lot of interaction is required, and the good part is the parents are also trying to understand more and more how to make this, because the kids are, or maybe as an adult also, we all are going through this phase, and we will be requiring a lot of emotional connect with everybody. So let all be healthy, and I believe health does not come only with the physical health. The emotional health is equally very important. So we will look forward to offer through I'm the Best Mom platform uh,
Yeah.
this healthy interaction with experts like you. And we are also continuously doing yoga for children, for adults, story, because we believe this thing also required when the child is growing, and we will keep continuing do the best of the thing which we can do under the platform of I'm the Best Mom. So ma'am, thank you once again, and thank you our attendees. They have been very patiently participating on all the polls, and I would request all of them to be a part of the group as well in the Facebook community. And we will keep on sharing all the good work which we are doing. Thank you.
Yes.
Thank you
Thank
once
you.
again, ma'am.
Bye bye. Bye.
Yeah.
Thank you.
Thank you so much. Yeah.
Thank you.
Bye.
Bye.
Thank you. Bye.